As COVID cases rise in the UK, we're looking into whether a spike in infections will be followed by a spike in deaths. This is Coronavirus, the latest from the Telegraph. I'm Theodora Louloudis. It's been 4 months since the UK government began to ease the lockdown, and a perhaps not unexpected side effect of more freedoms, coronavirus cases are on the up. Last Friday saw the highest number of recorded cases on any day since mid-May, with over 3,500 confirmed. Then Sunday became the third day in a row where the UK confirmed more than 3,000 new cases. It means the 7-day daily average has doubled this week on last. But on Monday, when the UK saw over 2,600 new cases, the country only recorded one death within 28 days of testing positive with the virus. But according to the WHO, that is set to change. On Monday, the body's regional director for Europe, Hans Kluge, warned that the rise in cases across the continent will be followed by a rise in deaths.
It's going to get more tough. In October, in November, we're going to see more mortality. It's a moment that the countries don't want to hear this bad news, and I understand. But I think it's very important that this is going to finish. This is not the end of the world.
The pandemic will finish, but are we going to see a surge in fatalities before that happens? To answer that question, I gave the Telegraph's global health security correspondent, Sarah Newey, a call. Sarah spends her days speaking to scientists and academics about the coronavirus, about treatments, vaccine developments, and any changes of the virus itself. So I started by asking her what the experts are telling her about whether or not the UK is likely to see a surge in deaths as cases rise.
Well, I think as with anything around coronavirus, there's not like a simple sentence answer. So bear with me. It's a complicated picture. Obviously, the overarching message is this is cause for concern. You know, yesterday the UK reported, I think it was some 3,300 new infections. It's not a small number. And the reproductive rate is now as high as 1.7 by some measures, which means that every individual who's infected is infecting at least 1.7 other people. But there are a few things to think about in terms of comparisons to earlier in the pandemic to start with, and what that might mean in terms of deaths and hospitalisations. So let's start with the comparisons. The first thing is to remember that we're testing a lot more people than we were testing in March, April time. So while the figures are kind of comparable in a base level to where we were back in March, actually we're testing like 175,000 people compared to about 7,000 people. So inevitably we're going to find more cases, and more of them aren't going to be severe cases.
Not least because we were primarily testing people in hospitals back then.
Exactly, that's the thing. So now we're picking up a lot more young people. There has been a marked shift in demographics, so more young people rather than elderly people are getting infected. And that in itself will have a knock-on impact, right? Young people, we know they're less likely to get severe illness, and we know they're less likely to die. So that's definitely a factor. Where we need to think about is there is a concern with rising cases, and we have a really bad habit as human beings of understanding what exponential growth means. So lots of experts have been talking to me about this whole idea of wheat and chessboard test, which is if you imagine you put 1 grain of wheat on the first square of a chessboard, and then you put 2 on the second, 4 on the third, and you keep doubling it until you're up to the 64 squares of the chessboard covered. How many grains of wheat do you think there are?
Oh, gosh.
I find it quite hard to imagine.
I'm terrible at this kind of thing. I think I'm about to prove your point exactly right.
Give it a guess.
Okay, so you've got 1 and then 2. Oh, it's going to be something crazy. I don't know, 1 million.
No, it's 18.4 quintillion.
Oh, wow. That's a lot.
Exactly. So exponential growth happens really, really quickly. So that's why experts are concerned about this uptick. But as I kind of alluded to a moment ago, you know, more young people are getting infected. We're having more tests. There's also better tools in place to tackle people who are ill. So experts are also saying, although there's a bit more division over this, but experts are saying we might not expect to see the same peak in deaths that we saw in March, April time. And if you look at the US, obviously they've had a huge second wave over the summer, but actually even though they had roughly double the number of cases, they had about half as many deaths. And this is also partly because their new pandemic was driven, or second pandemic was driven by younger people. So there's a lot going on. I think we're right to be concerned, and experts are concerned, because what happens now will have a knock-on effect in weeks to come. And if you don't act soon enough, it's all well and good saying in a month's time, oh, look, we haven't had the rise in deaths, but that may well have been because action was actually taken. Whereas if you don't do anything, then it might get into care homes and circulate among elderly people again. So it's a mixed picture.
With that in mind, do you think the key to keeping the death toll lower than it was over the last peak is not letting the virus spread to care homes?
Oh, care homes is a really big issue, yeah. I was looking back at the figures over the weekend, and it was almost 30,000 more people died in care homes in England and Wales between March and June compared to last year. And at least 2/3 of those deaths were attributable to COVID-19. So we're talking like 20,000 people, which is almost roughly a third of all deaths from coronavirus in the UK. So yeah, keeping it out of care homes and stopping it from spreading among elderly and vulnerable people is going to be a really big ask. I don't think the solution is going to be as easy as telling people who are vulnerable to shield. That brings in all sorts of problems around like work and who can, wealth issues and deprivation. We know different groups are more or less likely to get it, and you can't just tell all BME groups, for instance, to stay at home. That's ridiculous. But care homes are a big thing, and there are some worrying signs. One of our colleagues, Sophie Barnes, reported over the weekend that a letter was issued to care home bosses on Friday amid concerns that infections are rising in the elderly. But I think that is one of the biggest single things. If we properly get PPE in care homes, ensure that testing is available, and really put them at the forefront of the strategy, then yeah, inevitably, if fewer elderly people are infected, our death count's going to be much smaller.
I suppose it's also worth saying that over the last peak, many of the infections that led to that huge number of deaths were picked up when we didn't have social distancing measures in place,
exactly.
when far fewer people were wearing face masks. What effect do you think that that's going to have on this peak?
Well, actually, it's interesting that you mentioned face masks. I was talking to some experts recently, and they were saying, so a guy called Martin McKee from the London School of Hygiene and Tropical Medicine, really lovely guy, he was saying that actually wearing face masks and social distancing, there is some evidence that it might mean that when we get infected, we get less ill, because even if we've come in contact with a little bit of the virus, we haven't come in contact with such a huge infectious dose. And there's growing evidence. A few of my colleagues have written about this, if people are interested in finding out more.
We'll put the links in the show notes.
Yeah, there's some evidence that the more virus you're in contact with or exposed to, the more severely ill you'll get later down the line. So if we're all wearing face masks and we're distancing, even if you get ill, you might only get a little bit ill rather than really severely ill.
It's that question of viral load that we've spoken about several times on this podcast.
Exactly, yeah.
What are we seeing elsewhere in Europe, Sarah, in places that are perhaps earlier on in their second wave? I mean, obviously, countries are different. It doesn't always play out the same way. But what trends are we seeing elsewhere in Europe? Well,
it's an interesting picture, actually. I think it's a bit mixed. If we look at Europe as a whole, cases are surging in 14 countries in the continent at the moment. But over the last 68 days, deaths have remained relatively stable. And only 3 countries right now have seen an increase in their 2-weekly average, which is Croatia, Spain and Malta. And that's according to data from the European Centre for Disease Control. So it could be that suggests that it is fitting into this picture we talked about earlier, where there are fewer deaths in a new wave. But there are some worrying signs. So, for instance, France, we've compared ourselves to France quite a lot. Hospitalisations rose by 76% last week compared to the week before. And obviously that's inevitably, we're talking about this lag that we mentioned earlier. It tends to be that, it takes about 5 days for someone to show symptoms to start with. Then maybe another 5 days to a week until they get really ill and end up in hospital. And then maybe another 2 to 3 weeks until they die. And then in a lot of countries, it's then actually 2 to 3 weeks, this including the UK, after that the death even registers in figures. So the fact that France has seen such an increase in hospitalisations is a concern. But there other places that are more positive. So Sweden, actually, obviously Sweden is hugely controversial, and you do have to be a bit careful when you're comparing us to Sweden or any country outside of its neighbours, because, deprivation levels are different here, population density is different, all those sorts of factors. But there was a bit of a resurgence in July in Sweden, and it didn't really result in an increase in deaths. So it's a mixed picture, basically. There is cause for optimism, but you can also understand why experts are saying, we need to act now, because we don't want to follow the trajectory of, say, what's happening in Spain, for instance. They have seen an increase in deaths, but they're battling quite a spike in cases.
With that lag that you spoke about, as you say, it takes time for someone to develop symptoms, to go to hospital if they are experiencing very severe symptoms. Can you apply that to the UK? When do you think that we will know whether the uptick in cases is really causing more deaths?
Well, yeah, that's $1 million question, isn't it? Well, I think we'll know for sure within the next month. Well, I say for sure, maybe I shouldn't say for sure.
Nothing is for sure these days, I suppose.
Exactly. But we'll have a much clearer picture within the next month is the impression I'm getting. But then it does depend a bit on different factors. For instance, if over the next month it still is driven predominantly by young people and it doesn't get into care homes, then we're unlikely to see a spike in deaths. But say that changed in October or November or December, then it could all shift again, and actually we could see a really rapid spike in deaths, even if the increase in cases has been less substantial. So I think, and of course the other problem, we spoke about that whole concept of exponential growth a few moments ago. Of course, that's why the government will be acting now to introduce new restrictions, because you have to act early to prevent that really, really rapid escalation. And as we've heard reported a lot of times, there's a lot of evidence that if the government had introduced lockdown even just 1 week earlier, back in March, it could have saved thousands of deaths. So I think we'll have a clearer picture of where the UK is going over the next few weeks, but then you don't really want it to ever get to that point. You want to act before. So it's difficult to say exactly where we're going and what's going to happen, I think.
The other big difference between now and April and May, Sarah, is medical developments.
Absolutely.
And the improvements in treatments. What medical research has been done and what treatments have been discovered that mean that we're less likely to see an upsurge in deaths than we would have been a few months ago?
Oh, I'm really glad you brought this up, because I think it is a really important factor. There have been some really substantial steps forward. I think one of the biggest ones is dexamethasone, which is the cheap, widely available steroid. It's used in severely ill patients, so it doesn't help people at the beginning. You wouldn't give it to someone who just was at home, for instance. It's very much for when you're really severely ill. So according to the scientists who carried out trials, the recovery trial in the UK, the steroid can stop 1 in 3 deaths among patients on ventilators, and for patients on oxygen, it can prevent 1 in 5. So that's quite a big number. The other drug that has been shown to be effective is called remdesivir, which is an antiviral. It's shown to reduce recovery time. There's also been more understanding about the use of ventilators. When should you put onto ventilators, when shouldn't you? I think experts and doctors have, just from observation and getting used to treating patients, it's an element of medicine is trial and error, right? In terms of what actually works in an ICU. So I think there's more understanding of when to use ventilators, when actually it might be better to keep a patient off a ventilator and on oxygen. So that would make a difference as well.
Obviously, this is a new coronavirus, which is why we didn't know nearly as much about treating it in the beginning as we do now. But this isn't the first time that the world's experienced a pandemic. Sarah, looking back at history, is there anything that we can take from previous pandemics which could tell us whether we are about to see a surge in deaths?
Well, yeah, that's an interesting question. And if we look back at the major one that everyone always compares it to, it's the Spanish flu in 1918, 1919. And that actually saw a really deadly second wave. And I think that's stoked a bit of the concerns that we're seeing now. But flu mutates a lot more quickly than the coronavirus does. And that was part of the reason that it was so deadly then. We're not seeing that in the same way this time round. There have been mutations, but as far as we can work out, they don't make the illness more deadly. So with that in mind, I think actually there's a place to be optimistic that we might have the opposite with COVID-19, and potentially we're going to have a second wave of the illness, but not a second peak in deaths. Hopefully, touch wood. Let's keep our fingers crossed and hope that all the things we talked about in terms of care homes and things don't play out.
Sarah, I really, really hope you're right, both for the Telegraph's podcast output and for the world. And thank you so much for talking to us today.
No worries. Well, thank you.
The rest of the coronavirus latest news. An antibody treatment that could lessen the impact of COVID-19 is to be trialled on patients in UK hospitals. The recovery trial, coordinated by the University of Oxford, will assess the impact of giving patients a man-made antibody treatment known as REGN-CoV2 on top of standard care to see if it lessens the severity of COVID-19 cases. It's the same trial that found in June that the cheap steroid dexamethasone could save the lives of people with severe COVID infections. A government minister's instructed the British public to report their neighbours to the police if they host gatherings of more than 6 people. It comes as new restrictions make it illegal for a group of more than 6 to meet indoors and outdoors in England and Scotland. In Wales, it's only illegal indoors. The policing minister, Kit Malthouse, told the BBC that if members of the public see people flouting the rules and are concerned, then they should call the non-emergency police number. Britain's largest police force, the Metropolitan Police, said in a statement on Monday that officers would be patrolling public spaces to disperse large groups. Sir Keir Starmer is self-isolating after a member of his household showed possible symptoms of COVID-19. The person with the symptoms has had a test, and the Labour leader isn't reported to have shown any symptoms himself. If you'd like more information on any of those stories, head to the episode description where you'll find links to full articles. And if you're not already a Telegraph subscriber, head first to telegraph.co.uk/audio, where you can get 30 days access to all of our journalism on coronavirus news, politics, sport, lifestyle, and much, much more completely free for your first month. Subscribe to this podcast feed to make sure you don't miss my next update. And if you're finding these updates helpful, please do let me know by leaving a comment on Apple Podcasts. Thank you to everyone who's done that so far. It really helps me know that I'm making audio that you want to listen to. That really is the aim of the game. If you'd like to get in touch, the email address is coronaviruspodcast@telegraph.co.uk. And you can find me on Twitter. I'm at @T_Louloudis. This is Coronavirus, the latest from The Telegraph. I'm Theodora Louloudis.